36 Heachta agus a rís just module shrinta ama idir a colino marju gatina.
Gur mai go iascan cóirle. Agus a hána sé céicma iad sin atá deidil leis an bonus €1,000,000 I cur foiilte ra bheith caiim ar na bhfuil go leor sáilearú a go ddíra cétha deidil leis an bonus seo eil. Mar hampla cedéfadú in na glantarí is na hospital agus iad sin na bhfuil fástaí go ddíra ag an 5 minutes sláinte. And she glet salure horti for sin mar hampla. Ac yn grŵp boil mer di lat ar margin yn grŵp is mó boil mer di lat na curmari balle. Nes la yeb yen wes debber shit go jean jihla gan stad agus ni an na curmi seo able to lasser be want to see the public elle. Being a good jebre kidda wer fi hit sala shart la na shartnia agus kaher im hurmse antes o horti agus an bonus €1,000,000 a her fuel difa. Yesterday, the government announced that some healthcare workers will receive a €1,000 bonus payment for their work during the COVID-19 pandemic. And I'm sure that this is welcome news for many of those who will receive it. But there remains a high level of ambiguity about actually who exactly is going to receive this payment. And the government haven't been very clear about this over the last 24 hours. And I would appreciate this afternoon, Minister, some clarity in relation to how exactly it will be determined who will be able to receive the payment and when they will receive it. So, for example, what about the cleaners in the hospitals who aren't directly employed by the HSE and other agency staff? Will they be entitled to this €1,000 bonuses? But the group of people who feel most let down by their admission so far is the family carers. And family carers, as I'm sure you know, provide care that is very specialised, very intense and very intimate. And of course, they deserve recognition from everybody in this House, but they also deserve more than just a pat on the back or soft words. Over the course of the past 2 years, carers have seen respite curtailed, as well as access to day centres for those that they care for. And that's increased an already massive workload on those individuals, on family carers, as a consequence. And as a consequence of all of that, it saved the state money. Their care already saves the state hundreds of millions of euro every single year. And there's no use saying that carers, to carers that you'll get an extra public holiday instead, because family carers do not get the benefit of public holidays. Their role is 24/7. Indeed, family carers have said that it will probably put more pressure on them because day services will close that day. Schools will close that day. So it means that family carers and full-time carers will have no supports that day. So Tánaiste, their extraordinary efforts during this pandemic must be recognised. So I'm asking you, will you do the right thing and move to ensure that those in receipt of care support grant will also qualify for this €1,000 bonus payment? I think it's the very least that they deserve. Tánaiste, this morning we heard the Taoiseach on Morning Ireland, and he announced that a panel will be established to look at the categories of workers to be included under the COVID-19 bonus payment. And that raises a number of questions maybe that you could answer today. Who will appoint this panel, or has it already been appointed? Has the terms of reference been agreed by the Cabinet, and what are the terms of reference? Who will it report to, and when are we going to see a report? When are people going to know whether they are in or out? And I must say, while the announcement yesterday was welcome, it's clear that the preparation hasn't been done, with many workers still not knowing whether they will receive or won't receive this bonus payment, and I don't think that's fair. They will be waiting now, we understand, on the work of this panel, although there was no talk, I believe, of the panel yesterday, but it now emerges that there is. And this bonus payment was first promised by the Taoiseach in July of last year. The Minister for Finance, the Minister for Public Expenditure said it will be, agreed and announced well in advance of Christmas. That didn't happen. Yourself, Tánaiste, are on the record here saying that a bonus payment should not only be limited to healthcare workers only. So I ask for clarity in relation to these issues.
Thanks very much, Deputy, and welcome back. I think it's important to state that there are 3 elements to what the government announced yesterday. There is the day of remembrance and recognition. That is to recognise the 9,000 people who've died with COVID on this island, all of the workers, all of the volunteers and the general public for the efforts that they made to help us bring this virus and this pandemic under control. And that's the first element. It'll be a 4-day weekend running from the 17th to the 20th of March with a state ceremony and service most likely on the Sunday, the 20th. There'll be a new public holiday which all workers will benefit from, those in the public and private sector. It's an extra day fully paid, a day off fully paid, and also for people who have to work or choose to work on that day, they will get a day off in lieu or double pay. So even those frontline workers who have to work that day will benefit from it. I appreciate those who are not in employment or those who are self-employed will not, but we tried to cover as many people as we could. And the recognition payment, which will be €1,000 tax-free, that's going to be paid to frontline healthcare workers, over 100,000 of them. It's very hard to know where to draw the line in these things. We did give it a lot of thought, a lot of consideration, some consultation as well, and we decided that those who would receive this particular additional payment are those who worked in clinical settings, wore masks and gowns every day, were employees of the state, were exposed to COVID patients every day. Not just the risk of being exposed to somebody who might have COVID, were absolutely definitely exposed to people who had COVID every day. And we're in those clinical settings, and of course did so at a time when there were no vaccines, and that's the criteria essentially that we did apply, and that's over 100,000 people. That does include agency workers if they were if the agency was contracted to the HSE. So an agency nurse or an agency cleaner, an agency paramedic, working side by side with their regular HSE employee is included in this, and I'm happy to give that clarification here this morning. But where somebody worked for a private company, we'll say a private hospital, a GP practice, a pharmacy, or a private swab centre, they're not covered. But there would have been very substantial fees paid to those businesses, paid to those companies for the work they did during the pandemic. And many have already paid a bonus to their staff and can do so if they choose to, and up to 500 of that 1,000 can be done without any taxation. There will be further information today. That'll be in relation to the criteria and those who are covered and those who are not by the payment. But like I say, I can confirm that agency workers in public hospitals, agency workers who are contracted or seconded to the HSE, if that makes sense, or a public body, will be covered. We don't have the membership or the terms of reference of the panel finalised yet, but that will be done in the near future. When will the payment be made? It's our objective to have it paid in February or March. There is an issue around legislation. This does require primary legislation, both to amend the Finance Bill, or Finance Acts rather, and the Social Welfare Consolidation Acts. That legislation needs to be amended so that we can make it exempt from income tax from USC and from PRSI. That can be done quite quickly, and the objective is that it should be done quite quickly so that we can make those payments to people in their regular payroll payments in February or March.
Thank you, Minister. Well, I reckon there's 3 points to this, 3 different steps that were agreed. I'm focused in relation to the €1,000 bonus payment. This morning, the Taoiseach said a panel would be established. When it was questioned directly in relation to categories such as carers, he said that they aren't ruled out. So is it your understanding, because you've given an answer here today, that it's only those in clinical settings? So is there a possibility that carers will be included in the €1,000 bonus payment? What's the role of the panel? What will be their terms of reference? What is the job to do? Is it to look beyond clinical settings? Is it to look at areas such as carers or not? And you mentioned again in terms of the public holiday that people will get a day off, or if you're working you'll get double payment. Carers will get none of that. Indeed, this is going to increase the pressure on carers who predominantly were caring for those at the highest risk during the pandemic, and many who were immunocompromised will not be getting a day off, will not be getting double payment. Indeed, that is going to increase the pressure on them because the day services and the schools will be closed, so other supports that they would rely on normally will be not there. So, Taoiseach, you have made the point in the past that other jurisdictions limited their bonus payments to healthcare workers. I believe that carers were frontline healthcare workers. Do you believe that carers who provided that valuable work for the state to look after their loved ones during the height of the pandemic should be included in the bonus payment?
Thanks, Deputy. The government decision yesterday was that this would only apply to employees, but that would include that's employees of the state, but that would include people who are agency workers working for the state as well. There are different types of carers, as you know. There are HSE carers that work for an agency. There are family carers who are in receipt of carers allowance and carers benefit. There are family carers who are not in receipt of those benefits. But for home carers employed by the HSE, they would go around to lots of different houses. They may have been exposed to dozens or hundreds of people through the course of their work. Family carers would almost always provide that care in their own home, in their own household, or perhaps in the household of a close relative. So I think there is a difference there. But I do believe they deserve recognition. And the main thing that we want to do this year for family carers is to change the rules so that they can avail of the state contributory pension. Generally, somebody in receipt of the carers allowance is somebody who isn't able to get regular employment because of their caring responsibilities, and they miss out on the state contributory pension as a result of that. We want to change that this year, and Minister Humphreys has been tasked to do that. And I think that's our way that we can recognise family carers, and something that would be much more valuable, in fact, in financial terms, if you work it out, than a €1,000 payment.